Hello, everybody. Dr. Puya here. So, one of the main questions that I get on a daily basis is that, Doc, I cannot lose weight. I try to do everything. I try to watch my diet, cut calories, exercise, but I just cannot lose weight. And do I qualify for drugs like Ozempic or Mounjaro? And I need to increase my metabolism. So, I thought about maybe shedding some light to see what these drugs are, what they do, and if they're effective. So these classes of drugs, we can go on about them and talk about them for hours. They're very fascinating, and the mechanism of action, they're very effective, but they're not for everyone. And they come with a cost and a commitment and potentially side effects. So these classes of drugs are called GLP-1 receptor agonists. They raise this hormone in the brain called GLP-1 or glucagon-like peptide receptors. So they increase this hormone that's secreted from the gut, from the stomach lining, and the hormone does three things. It quiets down the food noise in your brain, so you think about food, think about addictive things, think about alcohol, think about sugar less. And also it slows down the gastric emptying so food stays longer in the stomach, so you get a feeling of fullness, feeling of satiety, and also increases insulin secretion, so the metabolism of carbohydrate goes up. So the three benefits are we get hungry and we crave food less. When we eat, we get full very quick. And also when we are eating sugary and starchy food, the metabolism goes up. However, there are side effects that come with these three functions. Number one, the foods that you really like might not taste very well. I had a patient that was on it for a while, and she said her kids think that she's not fun to hang out with anymore because when she has pizza or when they go out and want to kind of celebrate and have food and desserts and stuff, she just has zero cravings for anything. So she ended up stopping it. The other thing is because it slows down the gastric emptying, you might feel nauseous, you might get acid reflux, acid coming up to the mouth, you might feel like you're burping or feeling too bloated. Also, some people get diarrhea, some people get constipation when they go on it. And another side effect that I've seen is fatigue. People feel tired, people feel lethargic. Sometimes also people complain about their heart racing, even though it's not a stimulant. But that might be because it's, again, increasing the metabolism of carbohydrates. So one of them would be not liking much food, which is an effect. It's not really a side effect, but it could go to extreme acid reflux, bloating, constipation, and diarrhea, fatigue, and sometimes heart palpitations. These are not very common. Most people can tolerate these drugs, but they're not very common, but I have seen it. The other thing is compared to losing weight by other means, by cutting calories, exercising, things like that, these drugs cause more muscle loss, more usually if someone is losing weight just by themselves, by cutting calories, we expect about 20% muscle loss, 80% fat loss, but with these drugs, we've seen as high as 39-40%. So it's extremely important that when someone is on them, they do some strength training in addition to cardio. So either weightlifting, yoga, Pilates, something that you're really trying to put pressure on the muscles so you don't become skinny fat when you're losing weight. The other thing is these are lifetime commitments. Generally, if people get off of these drugs within 6 months to a year, the weight that they've lost comes back. I'm not saying the same dose all the time. What I've had as my experience with patients is that a lot of people are able to gradually, they go up, lose weight, and then gradually come down and be on a smaller dose, maybe a couple of times a month, 3 times a month. as maintenance. But maintenance requires for us to stick with a very, very healthy diet, typically a Mediterranean diet. Make sure we're exercising regularly, making sure we're not overeating, we're sleeping well, and those triggers that make us eat too much, we're watching for those. And one of the beauties of these drugs are because they quiet the food nose, they give us a pause. So we don't overeat, and before we go for something that we really like, we're able to pause and make a wiser decision. The two popular drugs that are in the market, one of them is semaglutide, which comes in two branded names: Ozempic, which is for people that have diabetic, and Wegovy, which is for people that are either overweight with a body mass index of 27, with some weight-related comorbidities such as diabetes, high blood pressure, arthritis, sleep apnea, high cholesterol, or their body mass index is 30. And Mounjaro, which is tirzepatide, is the generic name. The brand names come in Mounjaro and Zepbound. Mounjaro is indicated for treatment of diabetes, and Zepbound is indicated for treatment of obesity with the same indications: body mass index 27 with some weight-related medical problems, or body mass index of 30 without those weight-related problems. And they come in various doses, which we can talk about. But with weight loss, the most important thing is focusing on the type of calories, timing of calories, quantity of calories, and exercise, and also focusing on optimizing our sleep and mental health. Extremely important, and these are things that we'll talk about in future videos. Okay, if you like these videos, hit the share button, and I'll be updating you in the future. Thank you very much, and looking forward to hearing your comments.